Record after record shattered. Tonight, real concern setting in at hospitals. Good evening to you. I'm Corey Stark.
And I'm Samantha Jones. Both locally and nationally, the coronavirus is causing record highs in key categories. Tonight, COVID-19 hospitalizations in the U.S. are nearing 62,000. That is the most ever and more than double from just 2 months ago. St. Louis is also setting a high with 657 hospitalizations.
And the outbreak now causing some area schools to shift back to virtual learning, and teachers tell us they are reaching a breaking point. News 4's Ashley Lincoln gets us started tonight. She's at Barnes Jewish Hospital, focusing on the strain hospitals believe is very worrisome.
That's right, Corey. Local nurses are telling us tonight that they're dealing with two challenges here: the increased number of COVID cases, along with dealing with a nursing shortage. Now, we've been telling you that this problem with the nursing shortage has been going on for years now. Tonight, nurses are telling us that it has been exhausting trying to keep up with the demand that this pandemic has brought to our local hospitals.
We have to pivot on a dime.
Meeting the demand of a pandemic.
But for certain, there's a nursing shortage.
It's the challenge up against local nurses.
So we're constantly kind of shifting and bending with the needs of the patients. And we've really been doing that since March.
Mercy Hospital's top nurse, Robin Walbacher, says they've actually been preparing for what we're seeing now for months.
The conversations now are more around resilience and how to kind of maintain themselves.
With peak COVID cases surpassing spring numbers and ICU units reaching capacity, she says it's starting to put a strain on the 2,000 nurses within the Mercy system. According to the Missouri Hospital Association, 10% of registered nursing positions are unfilled statewide. In the St. Louis region, the vacancy rate is 9.1%, parallel with the 15% turnover rate.
Just the toll that it takes day in and day out when you're trying to, at this stage of the game, we're trying to combat COVID.
And nurses at St. Louis University Hospital say the same.
There are never enough nurses. There are never enough nurses. We're doing our best to kind of get them some extra help.
New data from the St. Louis Metro Pandemic Task Force shows 657 total hospitalizations. New hospitalizations in 24 hours going from 78 Monday to 114 Tuesday. Both numbers are single-day records for the St. Louis region.
What happens in the next couple of weeks, though, may be unlike anything we even saw in March.
Walbacher says to meet the demand, Mercy is creating flexible schedules, adopting team nursing where other medical professionals are helping to support nurses, and
looking at clinical nurses who are in non-clinical roles right now and how do they help support. So very different and innovative and creative things that perhaps we wouldn't have had to look at 9 months ago.
And Mercy also tells us that they are considering bringing in nurses from outside of the state if it gets to that point. And Corey, another factor playing into this nursing shortage is high turnover. And again, a lot of nurses are simply retiring. All of our local hospitals tell us that they are efforting to recruit nurses to their hospitals.
A lot of issues there, Ashley, in the Central West End for us tonight. Thank you.